Hi everyone, my name is Whitney and I'm a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Let's talk about getting your wisdom teeth removed and how to prepare and what to expect. And before we jump in, I'd like to remind you about my website, teethtalkgirl.com. If you're ever looking for a specific dental topic, I have a search bar where you can easily find what you're looking for, and also my Instagram, @teethtalkgirl. When your wisdom teeth are beyond a doubt impacted, infected, damaging your adjacent teeth, or otherwise causing you a lot of pain, your dentist is going to recommend that you have them extracted. But wisdom teeth extractions are actually a minor form of oral surgery. They're not the quick in and out, you need to have a tooth pulled visit that other types of extractions may involve. For wisdom tooth removal, most people request to be sedated, or as some people say, put under or under twilight, so that they don't have to think about everything going on around them. That being said, it's completely fine to stay awake during your wisdom tooth surgery if you're comfortable with that. Just communicate those needs with your dentist and find the best treatment plan for you. Depending on how your wisdom teeth are set into your jaw, a common way to remove them is to first numb that entire area of your mouth. Then the dentist or oral surgeon will open up the gums, remove a portion of your bone above the wisdom tooth, and then oftentimes section the third molar into multiple small pieces. This makes it easier to remove the entire tooth without causing structural damage to the surrounding tissues, nerves, or bone. Once the entire tooth is taken out, your dentist might place medication or a bone graft down into the socket. Then suture the extraction site closed. Sutures are similar to stitches and are usually dissolvable, or they'll need to be removed in the next week. Your dentist or oral surgeon will let you know which ones you get. Sedation. If you need sedation, or twilight, your dentist might refer you to an oral surgeon to have your wisdom teeth extractions completed. Oral surgeons are a type of dental specialist who perform treatments such as facial surgeries, extractions, and implant placements. Your dentist also might opt to send you to an oral surgeon if the wisdom teeth are positioned close to a facial nerve or impacted far down into the bone. With sedation during an oral surgery like wisdom teeth extractions, you generally feel like you're sleeping before the dentist numbs your mouth and begins the procedure. So you won't even be awake for the numbing part. You go in, you take a nap, and you leave. Most people do feel a little groggy several hours after and may not remember anything about the appointment. So if you're one of those people who says, I want to sleep through the whole thing, then make sure you and your dentist talk about the different types of anesthesia and sedation available in their office. Preparation. There are a few important things to do when you're preparing to have your wisdom teeth extractions. First, make sure your mouth is as healthy and clean as it can be. Brush and floss regularly to prevent any bacterial buildup so that you can recover without the risk of added infection. Second, prep for your recovery. Make sure you have someone drive you to and from the appointment and then to stay with you while any sedatives are wearing off. Now is the time to start stocking up on soft foods that are easy to eat and finding a place in your home where you can rest with your head elevated and still reach the things you need. You might want to plan on camping out in the living room for a day or two. I actually have a video all about wisdom tooth extraction recovery tips, which I will link that video in the bottom bar below if you'd like more tips and tricks. But one more thing to prepare, be sure to fill any prescriptions that your dentist has written and plan to take them as directed. Some people need to take antibiotics leading up to their wisdom teeth extractions because of infection. Others might have a pain management protocol set in place to ensure they're comfortable. Just be sure to have everything ready so that you're not scrambling on the day of your surgery. Wisdom tooth removal cost. Now the moment you've all been waiting for is the average cost of having your wisdom teeth taken out. This is where I start throwing in all sorts of disclaimers like it depends on if you're adding sedation or general anesthesia to your procedure, or which type of doctor is taking out your wisdom teeth, a dentist or an oral surgeon, and how many wisdom teeth are you having taken out. Plus, let's not forget, is it a straightforward extraction or are the wisdom teeth impacted? As you might have already guessed, simply getting a quote for wisdom teeth extraction costs isn't something a dentist can give you over the phone. A lot of it will depend on how the tooth is situated in your mouth, the process involved, and even what area of the country you live in, because the cost of living expenses. Oh, and don't forget to add your insurance into the equation as well. How much insurance covers for a wisdom tooth extraction might be 50% or it might be more. It just depends on your policy. As far as the dollar average for costs of extractions, the cheapest cost for having a tooth pulled is usually around $99. However, that doesn't include any type of general anesthesia, and it's only if the procedure is a simple tooth removal. But when we start talking about removing wisdom teeth, it might be somewhere closer to $220 to $340 or more just for the extraction, not counting any additional procedures or sedatives. When you see your dentist for your actual exam, they'll give you a detailed treatment plan that outlines the cost of wisdom tooth removal based on whether it's simple or surgical, any added fees for sedation, and then calculate your insurance benefits into the equation. That way you'll have a solid dollar figure as to what you can expect to pay out of pocket. There's no way you're going to ever get that information or even close to an estimate by simply calling offices around town and asking how much they charge for a wisdom tooth extraction. It's a case-by-case scenario. To learn more about wisdom teeth, I'll link my wisdom teeth pain and symptoms video in the bottom bar below, as well as my post-op recovery instructions video if you'd like to learn more. I hope this video helped you. Please like and subscribe if it did. If you want more teeth talk, you can visit my website, teethtalkgirl.com, for more articles and videos about dental health and dental hygiene. Peace, love, and teeth!